I think my journey into the world of trauma-informed care began during my internship. There was a woman who was in labor, and the pain was causing her to move around a lot. The attending physician attempted to manage the situation by holding down the patient's ankles in stirrups. She didn't explain to the patient what she was going to do or why she was going to do it. The patient, who was almost crowning, actually fought against the doctor as she tried to hold her down. It really escalated. And then I overheard a nurse quietly tell the doctor that the patient had a history of domestic violence. After hearing that, she adjusted her approach. I've thought about that moment so much over the years. Seeing that stark example of non-trauma-informed care deeply impacted me. Patients shouldn't have to choose to disclose traumatic experiences to be treated with respect and to feel safe in our care. I never wanted to cause a patient that kind of harm. I've often thought about how my perspective as a male OBGYN has influenced the way I communicate with patients. I don't try to deny that there are aspects of patient-provider interactions that I might not fully understand, but this awareness has pushed me to be more conscious of my language and actions. For instance, I've made a point to describe every step of a sensitive exam in a way that respects patient autonomy. It's about creating a safe and empowering environment for all patients. I've learned that it's crucial to ask for explicit consent before any exam, and I make sure to emphasize that they are in control by saying, "Let me know when you're ready to begin," instead of "I'm going to begin now," or "Is it okay if I begin now?" I've noticed that some patients who might have been uncomfortable have felt empowered to request alternatives or delay the exam. When there is a choice to be made about what interventions to use with patients, I provide them with an exhaustive list of options, including medications, procedures, and surgeries, even if they aren't good candidates for some of them. Patients may have felt that they weren't offered choices in the past, and giving them all of the information helps them understand the why and not just the what. I constantly remind myself that trauma-informed care should be routine for everyone. Trauma-informed care is about being attuned to our patients' needs, providing choices, and creating a safe and empowering environment, regardless of our gender or background. It requires constant reflection and presence of mind to ensure that our words and actions align with our intentions. Sometimes it means splitting a visit into multiple sessions to allow for thorough discussions without rushing, reinforcing to patients that their concerns are important.